Assalamu alaikum and most welcome. I'm very happy to be one of the panelists here and to discuss this one of the most vital topics actually, which is hygiene. Because as you know, and as everybody knows, prevention is much better than cure and than treatment. And to reach to the prevention, it means we have to follow the exact rules and the exact instructions for hygiene. And I hope the three of us will be able to illustrate how important the hygiene is and how the role of hygiene in preventing diseases, in making a healthy community, and in helping each other actually to live a comfortable, healthy, free disease life. Actually, there are too many aspects in the public hygiene prevention or in the public hygiene follow-up which can lead to the perfect life and can help the finance of the health services to decrease the finance of the health services, to decrease the expenses by decreasing the number of patients entering a hospital, by decreasing the suffering of the public if they follow the proper hygiene. And we will start with, each one of us will introduce himself. Actually, it was already introduced, but please, if you can introduce yourself and start. And then Mr. Naser as well, please.
Good afternoon, everybody. My name is Terbinderjeet. I am actually having a nursing background. My expertise are into nursing leadership, patient safety, and patient experience. Thank you, Dr. Mazen, for actually highlighting the word prevention is better than cure, because hygiene can cause serious repercussions if we do not take care of ourselves.
Mr. Naser.
Thank you. I'm Naser Khelaiwi. My initial experience probably would be differ from most of you. Besides being a number cruncher and doing all the finance and paying all the bills for the hospitals, my initial experience was on the consulting business, and then on the oil and gas, on the finance and reporting and governance. And for the last 5 years, I've been into healthcare systems in Saudi Arabia and Riyadh on the Ministry of Health, where it has been really challenging and interesting to be on that age where this whole healthcare transformation journey, corporatization journey for the health system, and where such interesting subject has been one of the fundamentals areas to focus on and become part of the preventive curing rather than curative, and it contributes much into the value-based health care that is focusing on the outcomes rather than other elements. There are financial aspects, as Dr. Mazen mentioned, around this on the optimization and efficiency of the spending. But probably I will represent an unbiased opinion because I'm not a doctor or a nurse, but still on the healthcare sector. So I will probably contribute on this subject as an individual of a community who cares about having hygiene and clean community. So we'll discuss further, inshallah. Thank you, Doctor.
So we will start actually to see what are the pillars for a proper public hygiene, which can help the community in having a free disease community and which helps in living a disease-free life. We will start with the quality controller here, with our quality, because normally if you see the combination actually here, we are medical quality, where the quality, of course, so the quality reports the infection control lady and the risk and the risk officer as well. And then we will help the finance to decrease the expenses of a hospital by following the proper techniques. So please, we'll hear from you how the things, what are the pillars in your opinion, what we can follow and how we can follow the exact hygiene to be able to achieve our goal.
Thank you for this interesting question, Dr. Mazen. Actually, I would like to highlight something. Those pillars that we are mentioning happens in our early childhood, actually. It happens at home. If you have children at home, it's very important for us to educate our children on how to keep proper hygiene, how to use sanitations properly. In 2021, WHO has done the WASH programs. Unfortunately, till today, we still do not have clean water. There's about 2.2 billion people around the world still lacking of clean water. So this is one of the great pillars to educate your children at home on how to keep hygiene. Throughout this whole processes, I think children should be also taught to educate them how to dispose of proper waste management, your sewage, waste management, keeping your environments very clean. So from there onwards, from your childhood, home, environment onwards, you step up to schools. So in schools, you have school-based interventions. That is one of the biggest pillars. I'm so sorry to say that at this moment, although we are striving to go for AI and everything, some parts of the world are still lacking school educations on public hygiene. Children are taught on dental hygienes, but children are not taught on how to do proper hand washing. Children are not given proper soap and water. Okay, they are also not taught how to do your defecation process properly. There are about 600 million people around the world who is still doing open defecation. So these are all contributing factors to me. I think further to that, maybe Dr. Mazen can add on some things to that.
Actually, I would say that from our previous experience and the previous suffering with the COVID-19, we have learned a lot. We have seen that the virus has spread from some parts of the countries more than other parts of the countries. The parts of the countries where this virus has been spreading, I'm speaking about the area here, it was the area, which is the crowded area, where the proper hygiene was not followed in these areas, and the population of this area were much more than what they should be. And these areas were the areas of the labor, the areas of the people who were working 24 hours without relaxation, without having peace of mind, without having relaxation for their body. So these people were more liable to get quickly diseases because their immune system was lower than other parts of the country and of other areas. That's why I would say that there are certain wrong concepts in hygiene. The wrong concepts are that, which have led to the pharmaceutical companies. They have gained a lot of money through these wrong concepts. Everybody has bought at home tens or hundreds of sanitizer to be put at home. But we forgot that water and soap are the best for hand hygiene and for personal hygiene. We have forgotten that taking bath a day and to take care of your personal hygiene would help the community a lot. We were using, unfortunately, and too many people were encouraging the hot dryers or the hot air dryers, which have been proven to be not the best, and which have been proven not to reach to every part of the body and not to kill all the germs which are on our hands and the areas which we are using it for. We have also reached to the fact that the children in the school, they are not taught properly how to reach to the best hygiene. When they cough, They should be, when they start coughing, they should be taught and they should learn that coughing, you should cover your mouth, that when you cough or sneeze, you should cover your mouth. You should put your hands on, or your elbow on your nose in order not to spread the germs you have. You should use, paper towels and not use your shirt or not use any other thing to be able to get rid of it and to get rid of the germs. I would like Mr. Naser to say, what were the expenses during this pandemic which we have passed through, and how much were the expenses of the sanitizers, of the PPTs, which we have been spent to be able to face this pandemic. We have spent a lot of money, which with the prevention alone, we could have saved a lot of it, actually. So from the financial point of view, in your opinion, what do you think, how was the load on the medical services in the institution where you were working from this huge expense to be able to face the pandemics, the viruses which were spreading, the bacteria in different phases of the year, actually? What can you tell us, please?
Okay, thank you, Dr. Mazen. I think COVID-19 has its own circumstances because it's unusual, infrequent, and there is a huge amount of cost incurred to prevent and fight the virus, and that probably can't be generalized across the years and the time because that's a special circumstances. However, I totally agree with you. There has been billions of dollars that has been spent. Not only on the curing the viruses and patients on the ICUs, but also into developing those new habits on the people to prevent getting contaminated with the virus, with using all the masks, sanitizers, developing new habits of like covering the mouth while coughing, etc. That behaviors has been developed, and we believe the amount that has been spent probably is a future investment, because I'm, for myself, as an ordinary individual in the community, have gained new behaviors to maintain hygiene, and therefore I will have positive impact on the community. When I checked in the room last night in this hotel, I found next to the bed 2 bags of sanitizers. We never have been seeing this before COVID-19, but although the pandemic is shrinking, going down, and probably we are getting live with the result, but still I think those new good habits has been developed and are becoming part of the inherited behaviors of the people. And that's what we probably can capitalize on and to contribute more into the public hygiene, because the more hygiene and clean you are, the more impact you will have on the whole community. And a family is a smaller community. If you maintain those habits, those will be communicated and therefore will escalate to the whole community. Now, financially speaking, on this context, I think probably the direction needs to be into more of focusing the investment and spending on the healthcare systems, on the preventive rather than the curative, because it really matters where that return on that investments will pay off in the future. Whose responsibility is this? I think everybody's, the family, the parents, and even the system. The system needs to redefine the spending on the healthcare system and focus more into making the wellness and well-being of people before they get sick. Since they're born until they get old, most of the funds are being directed to patients when they are admitting the hospitals. And chronic disease really constitutes large amount of those expenditures. With the new concepts of the model of care that we are probably looking at in our country for now as part of the Vision 2030, to maintain the new model of care and the value-based healthcare, is to focus and redirect those funds into preventive where we can go to schools, we can go to malls, start talking to children about habits that the doctor and yourself has just mentioned. Maintaining your clean or your hands, brushing your teeth, all the kinds of habits that will contribute. And so whatever we spend, and the initial investment will be probably high in the first place, but the return on that on the long run will be potential.
Yes. So what do you think about the public education in that? How can the public education plays a role in the general hygiene, actually? What is the major parts? How we should proceed with the public education in the different fields, at work, in the schools, in the nurseries, at home? How can it be? And what do you suggest as a program to be done for that?
First of all, I'll start with the schools. I think to enhance these hygiene programs, children in schools should have school-based interventions like create awareness first that what is your environment, where are you, how clean is your environment, get them to be attentive, pay attention to your environment, it's very important. Look around us right now, we are sitting in a clean environment. What if I take you to a beach that is dirty? Would you like to sit there? So these are the things that let them have the attention. Once they have the attention that the environment has to be clean, then you have to make sure they retain those attentions with them. The retentions are very important also because you do not want that to only happen once in a lifetime. You want this as a habit. Develop cleanliness as a habit. Once they start to develop this cleanliness as a habit, children should be motivated. Again, culture. Make it as a culture at home, culture in the school, motivate them. Teachers, parents, motivate them. Give them some reinforcement. I mean, I know many parts of the world, children are being forced or punished to wash toilets, dirty toilets. No, this shouldn't be the way. Cleanliness shouldn't be a punishment. Cleanliness should be a habit. So if we can promote all these things, awareness, attention, retention of knowledge, and also motivate and reinforce them, I think it can become a very good program for those things. And those things can also be used in workplaces, among food handlers. I can see sometimes, I mean, I've been here for 2 days and I was going with my mother to the food court. And I saw food handlers wearing gloves all the while. They are on the gloves and they're touching the food with the glove and also touching the surfaces with the glove, using the cloth to clean the environment. Now these are some things that we have to take into considerations or put into perspective because maybe they are not being taught properly. So again, very important, a very fundamental thing here is the leadership where we are working in. Workplace leadership is very important because a leader at the workplace should be first educated. And when you are educated, you can also overview your staffs. And when you overview your staff, you do not put it as a punishment. You did not do this, you did not do, no. Make it into a way that people will love to do that. I will change my glove because I need to prepare food. I'll change my glove now because I need to clean the environment, so on and so forth. And in the community, you see there's also a lot of things that we can actually enhance. Sometimes you walk around in the malls and you can walk about 100 meters, but you only find one waste paper basket or one dustbin only. And you'll be carrying your coffee cup or your tissue somewhere. And I can see sometimes, you can see tissues are being put into the seats, places, coffee cups are just kept like that and things like that. So these are all education, public education, where we can do it through internet, televisions and things like that. I hope I did answer your question.
Yes, exactly. I mean, which means that, I mean, in summary, that the public hygiene, to be able to create a healthy community, it is a chain. It is a rings of couple of people who are cooperating with each other, starting from the family, the nursery, the school, the community, the government, and each one of these, chains should play his major role to be able to reach and to achieve the target. The fighting of the mosquitoes, for example, in our community, it is not done by me or you alone. Treating the stagnant waters on the streets, the sewage on the streets, to be corrected properly, the drain of the rainwater, to avoid the stagnation of water in different places, to clean the surfaces of the public areas, of the recreation centers, of the metros, metro station. It is not done only by me, although I have to share in that by doing my part for myself. But it is also a cooperation between personnel, between the government, between the state, between the ones who are using these facilities. So it is, if we cooperate all together, I'm sure 100% that we will be able to reach to the target, and we will be able to live in a very healthy community, which is free to a major extent of diseases free, pollution free. All of these things can be with the cooperation of all of us together. We will decrease the expenses. We will decrease the number of sick patients entering the hospitals, which will be we will be again attacked from the hospitals. Why you are not sending us patients? Why the patients' number is decreasing? It is actually an equation on an equilibrium which should be solved in a different way, but we should play our role in creating a healthy community. I hope you agree with me.
Yeah, I definitely agree with that. Behavioral, simplify it as a behavioral change. We healthcare leaders today have to bridge these gaps between parents, schools, public, to educate them on better hygiene perspectives.
Yes, Doctor. I can't agree more with you. You are the experts in this field much. But I think it's a role by the person, by the family, the system also, and probably things like preventing the pollutions, the waste disposal practices, the recycling processes. That's also another contributing factor to prevent from communicating those communicable diseases, and probably will have more. So it's more of having the quality of life as a whole result, starting from developing a personal behaviors from the persons, the contribution of the systems and the government into maintaining that system hygiene enough through those practices. Overall, will have definitely a contribution to the whole quality of life, and as a result we will have less sick people, less patient, we will spend less on curing them, therefore maximizing the value of our money and budgets to be spent on the healthcare systems to redirect it in the preventive. And that will contribute positively more in things like the chronic disease, diabetes, etc., by having those habits, increasing the age of the people. So I think there are a number of interrelated contributing on this as well. Thank you.
Let's hear the opinion of our audience. Suggestions, opinion, questions of our audience to see actually we complete each other all, and the community should be actually the contribution should be from each one. How do you think, if I will ask you the question, how do you think that how we can reach to a perfect hygienic society where we can live actually in a peaceful, diseases-free, pandemics, endemics-free community and society? What do you think actually? If you have any suggestion, if you have any question, that would be great to hear and to discuss it together.
May I answer this question first, Dr.
Please,
Mazen?
please, yeah, go on.
I came from a country called Malaysia. I envy my neighboring country, Singapore. I envy Singapore. Those Singaporeans, if you are sitting here, I envy your leadership because you have created a very good hygienic program. In Singapore, you are not allowed to eat chewing gums and things like that. Also, they have very good habits. If you eat in public, you clear up your own tray. You clear up your own spaces. They have very good water and soap sanitations, most of the places. They have very good education. They have these Clean Singapore programs going on all around the year. And I seriously envy this kind of country because it's, if anybody of you have been to Singapore, yeah, you see Singapore is very clean. I mean, to see, it's very nice. So does Malaysia. My country is also clean, okay? But there is a problem. I think many parts of the world, we have pipelines in our house, water pipelines in our house. But there are issues with these pipelines. We have very good pipes, chrome base and everything, but the water does not flow from the pipeline. Okay, some pipelines have water which are rusty. I mean, will you agree with me if you have encountered that? You have rusty water coming out, you have pipelines that does not have water, so sanitations are problematic here. So these are things that healthcare leaders today, and I do believe we have AI analysts or AI specialists that are sitting in this crowd today that will help us, healthcare professionals, nurses and doctors, to develop programs, AI-based programs for schools, workplaces, to improve and also to assist us to speak to the leaderships of some regulations. We have a lot of healthcare laws, regulations done by the UNICEF, WHOs, OSHA and things like that, but we are lacking implementations.
Yes, actually, this is the point. I mean, the DHA, in United Arab Emirates here, the health system is one of the best, actually. I mean, I'm sure you have seen, I have seen, I'm living here for the last 33 years in the United Arab Emirates in Dubai, and the way how they have faced the pandemics which came to this area and to the whole world, it was one of the best, and it was ideal actually, which should be repeated in other countries. We have protocols, we have everything actually for schools, for nurseries, for public, for everything, but the most important things how to implement and the people who obey and do it. I mean, I'm a medical director of one of the hospitals. Until now, from the health authorities, we should put masks in the hospital. Masks in the hospitals are not removed. We are putting masks in the hospital, and I'm one of the people who do not remove the mask in the hospital, and it is in my pocket actually here. And even when I go to any crowded place, I put the mask. When I pass through the corridors, I mean in my hospital, whenever they see me, they start putting the mask. Whenever I turn my head to the other side, the mask will be here on their neck, and so on. So it is not the system, it is not the protocols, it is the human being himself who should follow and who should obey and who should know the facts and the reality that these protocols have been created and have been done to be followed. These protocols have been created after long investigations and after long search with all other countries to be able to reach to the proper how it should be done. And it should be followed. They were not done, and so much money was spent just to be put in the files of each individual in the hospital. No, it was done to be, it was created to be followed and to be done. If we follow it and if we know the rules, everything will be easy. Don't you think so, Mr. Naser?
Yes, of course, I agree with you. Dr. Mazen, I think one important thing that we have developed 4 years ago, and since the start of the pandemic, there has been numerous number of behaviors that has been developed. I think our role as family and individuals and government systems is to maintain keeping those habits, the good habits, going forward. 4 years ago, when you go to a hair salon or a barber shop, there is a below minimum expectation of hygiene and maintaining. The tools are not sanitized, no masks, no proper, exactly. And it was very severe during the pandemic. After that, and until now, in my country, for instance, it became part of the rules imposed on all those kind of services to maintain that upskill level of being hygiene on doing that service. So our role is to keep emphasizing and making these habits becoming part of our inherited principles to us and our children, to maintain more contribution into the hygiene system. So I think this is everybody's role going forward, and inshallah we'll have that very well positive impact on the community as a whole.
Inshallah.
Thank you.
Actually, this is all what we can, present for you today from the hygienic point of view. If there are questions, we are ready to answer your questions with the pleasure.
Yeah, actually, I have a comment, not a question. Actually, we all talk about wanting to have sustainable results, right?
Could you come closer to the mic?
The community, we want the community to be committed to hygiene. We want sustainable results. Don't we need sustainable effort to maintain that result? For example, we see at the time of pandemic, we see everywhere educational signs, educational awareness programs everywhere, here and there. Right post-pandemic, all signs were gone. People used to come back to what they used to do before pandemic. Yesterday at the airport, crowd, walking among the crowd, someone sneezed on the air. I can't imagine how many bacteria are going around and how many persons caught the bacteria. Because again, we have a reactive behavior. We tend to have a reactive behavior rather than preventive behavior. In terms of finance, do we have budget for preventive practices to prevent such pandemic to happen again? Now, before you used to see signs of how to cover your sneeze. Now I didn't see that everywhere. We used to see queues and lines, organized lines. Instructions, everyone is done that by law. We tend sometimes to do something good by law. How do we make that lawful practice a culture? I think by having a sustainable education, a sustainable awareness, sustainable effort, ongoing. Why do we have to do something once the issue is gone, then whatever effort has been withdrawn again, and we come back to the old practice? Don't you agree?
I agree with you 100%, and this is what we meant with the public education. Public education is not only for pandemics and endemics. Public education should be continuing. Posters should be put all over how to clean your hands, what you should do when you sneeze, what you should do when you cough. These should not be removed at all. The public education, whether it is in the nurseries, in the schools, at work, in the companies where you are working, in the workplace, this should not stop, whether there is an endemic, pandemic, or there is anything, because even flu by itself, even flu, which is a very simple thing which we are facing each year, and we are taking injections for it to avoid it to come. Even the flu needs the hygienic education to be able to avoid it and not to spread it. What happens, unfortunately, that most of the most of our wives or most of the ladies in the community, they are working. And that's why when the son of the family is sick, the mother, if the mother will sit with him at home, although she should, because he's sick and he's having 40-degree temperature, and she knows it might be a flu, it might be any other thing. If she will sit with him, she will lose 1 day from work. So this child, unfortunately, is given Brufen or paracetamol or any other thing, and he is sent to nursery or to school. Instead of sitting at home and the mother sitting or to find a way how to let him not to go to school, he is sent there, and from there the spread of the virus which the child is having. We come back to the same what you have said. It is the public education. It is how the people should be trained. Of course, the company should be a little bit flexible. If the mother will say that my son is sick, I mean, I should stay with him, there should be an excuse for that to avoid the spread of the viruses and the infection in the society and the community.
Yes, I totally agree with Dr. Mazen. I would like to also add in another point there. I think the support of leadership is also very important in this role. Yes, during pandemic, we did see thousands of posters coming up in the sky, but all of a sudden we see a decrease in all this awareness. Why? Because the leadership role does not step up all the time. I think once somebody is in the leadership role, you have to step up and inform everybody that this is the way to prevent things. So that's why the first quote that Dr. Mazen has told us during the first thing was prevention is better than cure. So also, from public awareness, leadership, this is two things that will combine together to give quality of life. So I do also want everybody that's sitting in this crowd, if you see there is a decrease in awareness in public health, please speak up on this, because this is important. If we do not speak up, nobody is going to speak up for us, because maybe somebody else is getting sick, but remember this, that somebody else could infect us also, or infect our family members also.
Yes, thank you. This is I agree with you totally. And this what we have been discussing a while ago, to retain those habits. I think if the baseline for the minimum level of protection and hygiene level before the pandemic was, let's say, 30%, and it shoots up during the pandemic to 90, it shouldn't come back to 30. I think we should go back to 50 or 60 or 70. And also from financial perspective, and I think it has those need to be part of the regulation. World Health Organization, the country system, healthcare systems. I think for now, if COVID-19 pandemic is over, the risk of having more severe and dangerous pandemic may happen. So we need to minimize the risk of getting into those circumstances by capitalizing and learning those lessons that we have been all facing, and probably imposing these measures and procedures as part of the system and healthcare regulations. If throwing a chewing gum in Singapore, at a point of time, you have to pay a fine. I'm not sure if that's still there, yes. But I believe that is becoming part of the individual's culture. And belief. Just like for us, like wearing the seat belts back here was not really mandatory by law, and I was not obeying about that. Now I wear seat belts all over, even if I'm going off-road deserts, even if I'm sitting. It became part of my habits. We need to capitalize on those habits, and my personal belief, you may disagree with me, but this needs to be imposed and become part of the law, at least for further few years, until the next generation absorbs those habits and are becoming really part of their daily, usual, minimum requirement level of maintaining hygiene level. So this is very important. Thank you for raising this up.
May I add in something? When I told about speak up, I would like to highlight something. According to WHO, the low-income countries right now is only having 9% hand hygiene rates. the high earning income countries are rarely touching 70%. So can you see the difference? Why diseases are spreading? Our hands are the culprits. So this is where we start from. Okay, and we start this from home, we start this from school, we start this from workplaces. And we kindly observe your environments. That's very important.
This is great. I mean, if there is no other question, then I hope we could we could deliver, the message how to follow the proper hygiene and how to sustain it, how to follow up. Hygiene is hygiene. It doesn't belong to a certain period of time. It doesn't belong to certain disease. Hygiene is hygiene, should be followed to be able to fight against diseases, against viruses, and to assure a healthy, disease-free community, inshallah. Thank you very much for listening, and thanks to my colleagues who could deliver the same message to you as well.
Thank you.
Thank you very
Thank
much.
you. Thank you very much. Fantastic discussion.